G-Fenesin Dm is a combination medication used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin, one of the ingredients, works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. The other ingredient, dextromethorphan, acts on the brain to reduce the urge to cough. It's important to read the package instructions carefully before using this product, especially if you are self-treating. Keep in mind that cough and cold products have not been shown to be safe or effective in children younger than 6 years. It's also important to note that these products do not cure or shorten the length of the common cold and may cause serious side effects. Always follow the dosage directions carefully and do not use this product to make a child sleepy. It's also important to avoid giving other cough and cold medication that might contain the same or similar ingredients without consulting a doctor or pharmacist. It's always a good idea to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or using saline nose drops or spray. When taking G-Fenesin Dm, remember to follow the directions provided by your doctor or on the product package. It's important to drink plenty of fluids while taking this medication to help break up mucus and clear congestion. The dosage of this medication is based on your age, medical condition, and how you respond to treatment. It's crucial not to increase your dose or take this drug more often than directed. If you are using the liquid form of G-Fenesin Dm, be sure to measure the dose using a special measuring device or spoon. Do not use a household spoon as it may not provide the correct dose. For powder packets, empty the entire contents onto your tongue and swallow, and for the capsule form, swallow the whole capsule. It's vital to not misuse this medication, as doing so can result in serious harm such as brain damage, seizure, or even death. If you experience a cough that returns, or if it is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or worsens after 7 days, be sure to contact your doctor. These could be signs of a serious medical issue, and it's important to seek medical help right away if you think you may have a serious problem. Some possible side effects of G-Fenesin Dm include dizziness, drowsiness, nausea, and vomiting. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. As for the best time to take this medication, it's essential to follow your doctor's instructions. Be sure to take the prescribed dosage and frequency as directed for optimal results. Before taking G-Fenesin Dm, it's important to talk to your doctor or pharmacist if you are allergic to guaifenesin or dextromethorphan, or if you have any other allergies. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to share your medical history with your doctor or pharmacist, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's important to talk to your doctor. For those using the liquid forms of this product, it's important to note that it may contain sugar and/or alcohol. Caution is advised if you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances in your diet. Additionally, the liquid forms and powder packets of this medication may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist before using this medication. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication while breastfeeding, as it is unknown if guaifenesin or dextromethorphan passes into breast milk. It's important to be aware that G-Fenesin Dm may interact with other medications, which could affect how well they work or increase the risk of serious side effects. This includes both prescription and over-the-counter drugs, as well as herbal products. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Avoid taking certain MAO inhibitors, such as isocarboxazid, phenelzine, or selegiline, while using G-Fenesin Dm, as this can lead to a potentially fatal drug interaction. It's also important to note that G-Fenesin Dm may interact with other medications, such as rolapitant. Make sure to check the labels of all your medications to avoid taking multiple products containing guaifenesin or dextromethorphan. Additionally, guaifenesin may interfere with certain lab tests, possibly causing false results. Be sure to inform your lab personnel and doctors that you are using this medication. As for the optimal timing and dosage of G-Fenesin Dm, it's best to follow your doctor's instructions. Typically, this medication is taken as needed, with or without food. Remember to not exceed the recommended dosage and to consult your doctor for any concerns about drug interactions or the best time to take this medication. If someone has taken too much G-Fenesin Dm and is experiencing severe symptoms like passing out or trouble breathing, it's important to seek immediate medical help by calling 911. You can also contact a poison control center for assistance. In the US, residents can call 1-800-222-1222, and in Canada, residents can reach out to their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. It's crucial to act quickly if you suspect an overdose. If your doctor has prescribed G-Fenesin Dm, it is important not to share this medication with others. It is also important to keep all medical and lab appointments while taking this medication. This will ensure that you are receiving the proper care and monitoring while using G-Fenesin Dm. If you forget to take a dose of G-Fenesin Dm, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take double the dose to make up for the missed one. When it comes to storing G-Fenesin Dm, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and do not freeze the liquid form of this medication. Different brands may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist. Always keep medications out of reach of children and pets. When it comes to disposing of G-Fenesin Dm, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.